Endometriosis, it's when your uterine lining forms outside your uterus. Every woman with my disease has different symptoms. It manifests itself in so many ways. The pain it just spikes until I'm 2 or 3 days where I just can't move.
I had been diagnosed with breast cancer in 2010, and prior to that, went into menopause. However, in April of 2013, I had menstrual bleeding, which should not have happened if I was in menopause. Having now other medical issues that somewhat could be related to the breast cancer, being ovarian or uterus, was absolutely frightening.
I lost my first baby in 2010. He was born around 32 weeks. And then I had another son in 2012 who almost made his 34-week mark. They told me that my cervix had shortened and that it was thin, so it was no longer able to hold the weight of the babies. So once they reached a certain point, they would start to come out. All I could do is hold him till his heart stops.
When we talk about building the best women's hospital in Canada, we're talking about having some of the most innovative programs that offer specialized care to women. And this is why advanced minimally invasive surgery, developing that surgical program really helps all those areas. It helps in our obstetrics, it helps in urogynecology, it helps in our oncology. That's why it's so important as we look at these next few years of fundraising for our hospital. This is the area we need to focus on.
Traditionally, gynecologic procedures will be performed through a big incision. So it could be anywhere between 7 and 10 centimeters or even bigger. With minimally invasive surgery, we are able to perform the traditional procedures, but in a non-traditional way. We are able to perform it either with no incisions or through tiny incisions, or through laparoscopy, where we put a camera through the belly into the abdomen to view the organs and perform the procedure. So with advanced minimally invasive surgery, the difference is that what would normally construed as not possible through laparoscopy or hysteroscopy is now possible.
Having had cancer, it's always on my mind, every day. Of course, when I went to Dr. Patel with this new issue, she did suggest, given my age and my medical history, that to do the full hysterectomy was probably my best solution. Absolutely difference night and day between having my appendix taken out when I was 18 and I still have a scar. Whereas, I mean, if I checked today, I don't even know if you could tell that I'd had that surgery a year and a half ago.
When I was referred to Dr. Patel at the Lois Hole Hospital for Women, she gave me hope because she knew the disease. She knew the treatment options. She knew that she could make my life better one way or the other. Dr. Patel did a hysterectomy and ovary removal. I've got it all gone with 4 tiny little scars. What she does, basically, I think it helps women keep their sense of self, because when you look in the mirror naked, you don't want to have to see the physical scars of your mental agony.
Let's say you're sleepy or feeling a bit nauseous, we'll keep you overnight.
I'm passionate about minimally invasive surgery. I can't help it, it's what I love doing. But I'm also even more passionate about it, not just because of the thrill I get from being able to do the procedures that I know are better for patients because we have the scientific evidence to prove it, but also because I'm able to empower my patients with the information so that they can make those choices for themselves.
The major advantages are for patients. The recovery time is much less, and people are back to work and back to their lives and back to productivity much sooner. In a lot of cases, it can be a lot safer as well.
After I lost both my babies, there was an operation that they told me about in Toronto that I could get done. It wasn't being offered here. A couple months later, I got a call back from the doctor's office saying, we got a new doctor in. that could potentially do this operation for you. Would you like to come see her? I'm like, yeah, of course, yeah. When can I come? I had the operation done, and about 2.5 months later, I was pregnant. D'Angelo, he's 13 months old now, so we recently celebrated his first birthday. He loves music. You can sing a song and clap and he'll dance. He's a pretty happy little guy. He's always smiling. After suffering such losses, he has made it all better.
September of 2015 will be 5 years since my breast cancer diagnosis and surgery and treatments. Dr. Patel, I mean, the peace of mind that she gave me is what it was all about.
If I compared myself to how I was just 2 years ago, I'm not that person anymore. This is the best I felt in well over a decade.
The operation I got is life-changing. Without it, I would have never had my son.
My dream for the Lois Hole Hospital for Women is to have a very real minimally invasive surgery program in the form of a division that not only contains me as the advanced laparoscopic surgeon, but other expertise to be able to provide a multidisciplinary approach to our women and to be able to perform the training and the research and be the world leaders that we can be in women's health, especially in minimally invasive surgery.
Donor support has been critical to the success of the hospital over the past 5 years, and it's going to be critical over the next 5 years in all of our areas of fundraising. We are so grateful to the donors, to the people who attend Harvest Celebration, to the sponsors of Harvest Celebration. A lot of our successes over these past 5 years, it's due to them.